Yeah, so today I'll be just sharing some perspectives and some evidence of acupuncture, and mainly from the point of view of a Western medical doctor. So just a brief introduction about a bit about my background. I'm actually a rehab physician. I work in Tock Seng Hospital, and our rehab center actually see and manage disabled patients with various diagnostic groups, such as stroke, traumatic brain injury, spinal cord injury, and amputations, etc. So we look at their impairments and we help them to become as independent as possible. So some of you may have read or might remember reading about this Bangladeshi worker who earlier on, in the earlier part of the pandemic, suffered very severe COVID-19 infection, spent 2 months in ICU, and then improved after that, came out of ICU, spent a few weeks in our rehab center undergoing rehab, and managed to walk out of hospital, right? He was the one whose wife actually gave birth to a baby while he was still in ICU. So we are actually, yeah, we were very happy that he actually recovered so remarkably. As for my acupuncture, I'm actually was actually trained in acupuncture in Australia when I spent a year there as part of my specialist training. And I'm a fellow of the Australian Medical Acupuncture College. And I'm also accredited as an acupuncturist with the TCM board. I will talk more about this in the later part of my talk. And I personally practice acupuncture mainly to treat painful conditions. Right? So what is acupuncture? Um, Briefly, acupuncture involves the insertion of sterile and very fine needles into specific points of the body called acupuncture points in order to treat various ailments, in order to maintain wellness. Right? And it has a very long history. So it is one of the forms of treatment of traditional Chinese medicine. So together with TCM, all right, it has been practiced in the East for a few thousand years. And then when we look at TCM, apart from acupuncture, the TCM physicians practice other modalities of therapy as well, such as herbal medicine, cupping, and moxibustion, where they actually burn a specialized herb over particular areas of the body. And the warmth and the herbs actually help to stimulate the acupuncture points. So what type of needles, all right, did people use in the prehistory period? So there's archaeological findings. People have excavated cities and of long ago and found that likely the first acupuncture tools were actually made of stone. And later on, when metal was discovered, they had or they made copper needles, bronze needles, and even needles made of silver and gold. Right? As you can see from this picture, needles of yesteryears were quite big, thick, all right, and they look as though they would cause quite a bit of discomfort. And needles nowadays are made of stainless steel, very thin, all right, and their tips are actually not sharp like our hypodermic needles that we use for injections. So they are a little bit blunted so that they cause actually less damage to the inner tissues when they are inserted into the body. And in prehistory, and even I think a few decades ago, acupuncturists actually reuse their needles. They would sterilize them by, I think, heating them or boiling them to kill the germs. But nowadays, the needle companies will make them individually wrapped. They come sterile and only for single use. So once we use the needle, we would discard them straight away. So we do not sterilize them or reuse them again. So that's for infection control. Okay, so I will briefly give an overview of some TCM concepts so that we can understand a little bit about the practice of acupuncture from a TCM physician's point of view. Okay, so TCM physicians, acupuncturists believe that there's this vital energy that's flowing in our body. It is called qi, right? And this energy flows along specific channels throughout our body, and we call them meridians. Each meridian is connected or closely associated with a particular organ. Right? So there are 12 regular meridians and 8 extra ones. And along the course of each meridian, there are specific points, right, via which we can access the energy that's flowing through these channels. And we call this, these are the acupuncture points, okay? So every acupuncture points, there are, a few hundred, more than 300 acupuncture points, would have a Chinese name. And some of these names are really very poetic. But in order to help the English-speaking world, all right, understand and then localize and communicate amongst themselves, the World Health Organization has issued a standardized way of naming these acupuncture points. So the points would be named according to the meridian they're located on. So let's say GB20 refers to gallbladder meridian, and the 20, they are numbered in the order that they appear along the meridian. So GB20, gallbladder 20, will be the 20th acupuncture point on the gallbladder meridian. So that's also how we locate and name the points and communicate with each other to say, oh, which points are you using? And once we mention that, the acupuncturist would understand each other. So just again, briefly mentioning some other concepts that the TCM physicians would use. There is the yin-yang theory. And in this, just simplistically describing it. So in this theory, they look at how everything in nature works, and they believe that there's a concept of duality, right? There is yin when there is yin, and there's yang. So yin is the characteristics of yin, all right? Dark, quiet, a sense of cold, reservation. And then yang will be the opposite, bright, active, energetic, associated with warmth. And the belief is that we need to balance these two, all right, yin and yang, in order to achieve optimal health. When yin and yang are in imbalance, when there's excess of one and or a deficiency of the other, that's when you feel unwell, you feel there's pain, and then there's organ dysfunction. The other theory that is often talked about is the 5-element theory. Here, they use this theory to explain how organs work. They believe again that everything in nature can be classified into one of 5 elements. All right, these 5 elements will be wood, fire, earth, metal, and water. And each important organ in our body, all right, would have the characteristics of one of these elements as well. And when there's organ dysfunction, we can select the appropriate acupuncture points, all right, to regulate the function of this particular organ. So again, to give just a brief overview, some of the goals of what a TCM physician would want to do, all right, to in the treatment of patients would be actually to regulate energy, this vital energy, this T, all right, to either reduce the levels of the energy if it's excessive, replenish it if it's deficient, or if the circulation of the T is blocked, obstructed, to use acupuncture to clear this obstruction so that the energy can flow freely and flow properly. And uh, the the unobstructed flow of energy, all right, is also important in driving the circulation of blood in our body. Right? So the physician would also use acupuncture to balance yin and yang, to remove any factors which are harmful in the body, such as dampness, what they call phlegm, the sticky fluid that clogs up our body, wind, which they believe often causes pain, which flits from one part of the body to another, like sort of symptoms of rheumatism. And also, very importantly, they want to nourish and strengthen the internal organs. So um, we know that TCM has been practiced and has been a very important part uh, of the health system in the East. But how about the West? Right. So from this cartoon, you can see this cartoonist imagining, that perhaps in the earlier days, when there were two warring factions, and when one soldier shot his enemy in the leg with an arrow, the arrow actually happened to hit an acupuncture point, and suddenly, instead of the enemy collapsing in pain and getting very angry, the soldier actually became very grateful and thanked him for curing his frozen shoulder. So this is just a cartoonist depiction of the distant effects of acupuncture. All right, but seriously, what really made a lot of Americans sit up and become interested in acupuncture actually happened in the early 1970s during President Nixon's visit to China. So he visited Beijing, which was called Peking at that time. And President Nixon has been accredited with introducing acupuncture to America. So around that period, James Reston was a journalist who was part of the government official entourage who visited Beijing. And while he was there during his trip, he developed symptoms and signs of acute appendicitis. So he was admitted to a Beijing hospital. He underwent emergency surgery to remove his appendix. That all went quite well. But about a few hours after surgery, he became very uncomfortable. All right, he had fever. He had a lot of tummy bloating, a lot of distension, and he was in a lot of pain. So at this time, he was actually visited and treated by a team of acupuncturists. He mentioned in his report that they needled him and they gave him what sounded like moxibustion. And within an hour, all right, all his symptoms settled without the need for Western medicine. He was really quite impressed, and he wrote a detailed article which appeared in the New York Times. And I think from that article, it generated a lot of interest, all right, in acupuncture in America. And since then, all right, there have a lot of acupuncture schools have been set up. A lot of acupuncture treatment centers, all right, have been set up, not just in the US, but in various parts of Europe as well. Okay. So acupuncture is very popular, all right, in the West. Research has shown that it is used by at least 3 million Americans a year. And when they looked at the types of conditions, all right, which patients were presenting for acupuncture treatment. Um, they looked at the top 10 most common causes or conditions, and they found that pain actually uh, constituted 7 of this top 10, right? Pain in various parts of the body, the back, the joints. Osteoarthritis is a degenerative arthritis, often affecting the knee in the older patients, um, where the articular cartilage becomes thin and degenerated. Pain in the neck, headache, myofascial pain is pain in the muscles, the soft tissues area. Tennis elbow is a pain involving tendon on the outer aspect of the elbow. So all this, are common conditions or common diagnosis that drive patients to seek acupuncture treatment. So the World Health Organization has also compiled a long list of conditions. They have looked, the panels have looked at the evidence for acupuncture and have come up with a list where there is some evidence that acupuncture can be effective. All right. It is a fairly long list, includes things like depression and again pain. All right, appears in this list. Pain in various areas of the body, face, headache, knee. All right, back. So acupuncture is also, there's also evidence for it for treating morning sickness, nausea, vomiting, right? And the list goes on. So we all, research has also been done in Singapore, all right? And we also know that acupuncture is very popular in Singapore. Over the past 2 decades, various teams of researchers have looked at the use of complementary and alternative medicine in Singaporeans, in the local population. And complementary and alternative medicine, or in short, CAM, includes things like TCM, traditional Malay, Indian medicine, naturopathy, homeopathy. And they found that of all the various types of CAM, TCM is the one, all right, that is the number one CAM that is used by Singaporeans. And when they look at which type of TCM patients actually go for, it is actually acupuncture. The majority actually opt for acupuncture. And this applies across the races in Singapore, right? Apart from the Chinese, the Malays and Indians also, all right, opt actually for TCM and acupuncture treatment when they are not feeling well. And when they looked at, what illnesses prompt people to seek TCM acupuncture, they find that usually patients with various chronic illnesses, such as people with heart disease, with chronic skin problems such as eczema, and with various types of cancer. Right? So in the year 2000, a Ministry of Health set up a TCM board to regulate the practice, all right, of TCM and acupuncture. So all TCM physicians and all acupuncturists have now to be registered before they receive the license to practice here. And they all must follow the code of conduct, uh, ethics, and practice set up by the TCM board. And when we look at the register, there are more than 2,000 TCM physicians here who are actively practicing. And there's actually a separate register for acupuncturists, all right? Those who are non-TCM physicians, I think most of them are Western trained doctors who are also certified to practice acupuncture, but not TCM. And almost all restructured hospitals now in Singapore have an acupuncture clinic located within their practices. These acupuncture clinics are most often staffed by TCM acupuncturists, but most of the TCM acupuncturists are actually out in private practice. So now we come to this very important question, all right? We know that it's popular, but does acupuncture really work? All right, is it really effective? Okay, so um, from the Western point of view, we like to look or we attach great importance to good research and strong evidence from high quality research, but it is quite difficult to do high quality studies for acupuncture. All right. So before I even say that, I think some of the skepticism in the Western medical world about acupuncture is that scientists have not been able to actually invent machines that can detect and measure this T that we talk about, all right, this vital energy. So, I think today the instruments have not been sensitive enough to measure. So this T and energy thing is still not objectively evaluated. Okay, so that's one point. The other thing is that in medical circles, the highest standards of studies are those what we call randomized double-blind controlled studies. Maybe I'll just take a little bit of time to explain this. So when we talk, what we mean by this is that, let's say I give you an example of aspirin. We want to see whether aspirin, let's say 300 milligrams of aspirin, works to prevent heart attacks. So in order to do research properly, we need to have a treatment group, all right, a group that receives this aspirin. And then we need to have a similar group that does not get the aspirin, maybe gets something, what we call a placebo, which is actually something like a fake pill, a pill that looks like aspirin, but it's not aspirin, all right? And then the patients receiving the medicines would not know whether they got the aspirin or not. The people who are giving them the medicines would not know whether they gave the patient the aspirin or not. So this is to prevent biasness, to prevent preconceived ideas that would color the results of the study. So when we talk and when aspirin is given at 300 milligrams, everybody gets aspirin at 300 milligrams. All right, it's a standard treatment that you have to apply to all the patients in the treatment group. But such a study would be very difficult to do for acupuncture, all right? It's hard to do fake acupuncture. We call it sham acupuncture. I mean, that's maybe another talk entirely. There's quite a lot of things to mention, but it's hard to, again, have a fake acupuncture group. It is difficult for the acupuncturist not to know whether he's giving the real acupuncture or not. And it's sometimes also, patients also are aware whether they are receiving the real acupuncture or not, right? So all that introduce biasness to the studies. And then when you give a standard acupuncture protocol to all the patients, it might not work because when we talk to acupuncturists, you talk to the physicians, they will tell you that everybody is different. Everybody has a different constitution. So if you have a standard prescription of acupuncture for all patients, it is unlikely to work, all right, very well. But it does not mean that acupuncture doesn't work. So there are all these problems with methodology. And when researchers looked at the acupuncture studies which have been done, they have found that many are poorly designed, numbers are small, and it's very difficult to compare the different studies because different researchers used different techniques, different points, and their treatment program was different. So very hard to compare across different experiments. So because of this, the research has produced evidence that is quite conflicting and not very, very strong. All right. So the evidence that acupuncture works for things like stroke, for chronic lung conditions like asthma, for heart disease, has still been fairly equivocal. All right. And a lot of this is related to methodological flaws in the research itself. But I think for chronic pain, all right, the when you compare across all these diagnostic groups, the evidence for chronic pain uh, is still relatively strong. All right, so this study was published in 2018, and what the team did was to actually looked at 39 studies, so pooling the data of more than 20,000 patients, all right, receiving acupuncture for a range of chronic painful conditions. And they concluded that acupuncture is effective, all right, for treating chronic muscles or bone pain, headache, and osteoarthritis. And then this pain is not just temporary, but they actually last for a period. All right, so that's their conclusion. So, from a scientific perspective, how does acupuncture work? Right. So, the effects of acupuncture can be divided into two broad groups: local and distant effects. When I say local effects, what I mean is that let's say a patient has neck, shoulder, upper back pain. Right. You treat the local areas of pain with acupuncture, and that results in pain relief. And how does this happen? All right. So uh, these are some theories which have been used to explain it from a more medical point of view. All right. So this is the gate control mechanism, or gate control theory of pain. So let's say you have this painful scar which is causing you a lot of distress. So when you treat and when you needle the acupuncture point nearby, so what you're doing is that you are activating certain nerves which go to the spinal cord, and from there, certain impulses actually travel to this area to actually block the transmission of pain signals centrally to our spine and brain. All right. So through this blockage of the transmission of pain signals, we get pain relief from acupuncture. All right. So distant effects, when we talk about distant effects, what we mean is that when we needle a particular acupuncture point, the patient feels relief somewhere else in another area of his body. All right. And there is quite a lot of research studies now to show that acupuncture does have this distant effects. Okay, one is via brain imaging. So now the there's quite a lot of research studies using functional MRI. So in functional MRI, it's a sort of more specialized form of MRI, where in which they actually measure, they're able to see brain activity in real time. Okay, and they found that when acupuncture is done, those brain areas that mediate pain, all right, become much less active. Right, so a patient will be in the MRI scan room, all right, with the MRI scanner, all right, and then the brain activity will be measured, the scan will be done, and then the acupuncturist will put in the needle, and then the MRI scan would be repeated, all right, and then the pictures would be compared. All right, so they found that needling an acupuncture point in the toe bladder 67, which acupuncturists use for patients who complain of blurring of vision, actually regulates or changes the brain activity in our visual centers in the brain. All right, there's actually increased activity in the occipital lobes where the visual centers are. And this does not happen when the acupuncturist did fake acupuncture, sham acupuncture, or fake acupuncture. All right, and large intestine 4, I'll also talk a bit more about it later. All right, so when the acupuncturist needled this acupuncture point, activity in the limbic area and subcortical structures, all right, areas which are involved in pain, the sensation of pain, and the emotional distress associated pain actually became less active. Right? And when they, what they did was they compared this needling with tapping the area with a wire, and no such brain changes happened, all right, when they tapped the point with a wire instead of proper needling. So this is just a picture to show you a little bit about what I mean. Right. So CTS is carpal tunnel syndrome, right? So in carpal tunnel syndrome, patient has this nerve compression or nerve damage around the wrist area, and it causes pain and numbness in the three fingers in of our hand, usually the thumb and the index and middle finger, and sometimes part of the ring finger. So this is the picture of a brain scan in healthy adults, those without carpal tunnel. All right, you can see in the carpal tunnel syndrome, before acupuncture was done, there's a lot of brain activity. And when after received acupuncture, all right, this brain activity actually settled down. So other ways of looking at how acupuncture produces distant effects is again through the pathways. This is an extension of the diagram I showed earlier to explain the local effects. So again, what this busy slide shows is that, you know, when you needle an area, nerve impulses travel up the spinal cord to the brain, and the brain actually sends down inhibitory signals to multiple levels of the spinal cord. All right, so and so in a way, what this means is that possibly, all right, multiple gates become closed when you needle an area, and that may explain acupuncture at one point relieving pain at somewhere else in the body. They have also looked at what happens to the concentration of certain chemicals in our brain. All right, our brain actually contains natural painkiller neurotransmitters or substances known, and we call them natural opioids, versus the synthetic ones like morphine and tramadol, which doctors give in the hospitals. So all our brains contain these natural painkillers, right? And so researchers did animal studies. These studies are done on animals, and when they did needling for these animals, and they found that the brain concentrations of these various substances actually dropped, all right? Actually increased in some of these animals. So these natural opioids include substances like dynorphin, endorphin, and enkephalin, and they are important, all right, in producing analgesia for various types of painful conditions in our body. So you've seen some of the theories. So what is important to know is which type of patients should not go for acupuncture, all right, for safety reasons, okay? So contraindication means caution in this group of patients. So those with severe bleeding tendencies, that means they have some deficiency of clotting factor, platelet counts very low, you know, or patients who are receiving strong blood thinners like warfarin. So for these patients, there's a higher risk of bleeding. So what we worry about is deeper sort of internal bleeding that is prolonged and that can actually become quite dangerous, right? So superficial bleeding, those from just superficial needling and puncture of the skin, those we can, we can stop by just putting pressure for a longer time. But what we worry about is bleeding into deeper muscles, deeper cavities, organs, and joints, all right? So we are very cautious with this group of patients. Needle phobia, there's some people who are very sensitive to even the sight of the needle, sight of blood, and they faint promptly. So for these patients, we do not recommend acupuncture. Those who are systemically unwell, that means they have a severe infection, all right, that's affecting their body, their health, we would like to withhold acupuncture first. We treat the infection, and after that, evaluate them again to see whether acupuncture would be a good form of treatment. Those with major skin problems around the acupuncture points, ulcers, burns, pressure sores, we are also very cautious. And pregnant women, because certain acupuncture points can actually induce labor, all right? So we are also very careful in this group of people. Okay, so side effects, all right? Now we'll just look at some of the side effects. In general, acupuncture is a very safe procedure, especially in trained hands. The adverse effects, the side effects, probably the most common would be just superficial bleeding, because the needle has pierced the skin, all right, and the superficial tissues. These we just stop by pressing on it with a clean cotton swab or something, and then usually no major adverse effects on the patient. Fainting spells, some especially people who didn't know they were needle phobic. So for first time patients, what I would recommend is that we will usually treat them in a lying down position. We'll usually ask them to lie down, be comfortable before we actually needle them, especially for the first session. Because if they were, to sit up, we'll to sit them up, treat them, and then they faint, then it may just fall out of the chair and have more problems, right? Deep bleeding in muscle, not common, but something that we have to watch out for. Retention of needle, rarely, acupuncturists forgot to take out the needle and left it there. And then of course, people do get quite upset. So, but uncommon, because nowadays we have a quite strict protocol. We actually count the needles. The acupuncturist would count them, record the number of needles he put in. The assistant will help them. When these needles are removed, they count them again and make sure the number tallies. Okay, infection, also very uncommon, particularly now that we use only sterile one-use needles. Puncture of internal organs like lungs, etc. Very, very, very rare. With acupuncturists who are trained, well trained in anatomy. So, so people would often ask, I suppose, a common question would be, is acupuncture recommended for my pain? All right, I have this painful condition, should I seek acupuncture to treat it, all right? So this is an approach that I would like to suggest, like to put forward one possible approach. If a person has been having chronic pain, right, for a few months, he or she has tried various things and it hasn't really worked, all right, and now is thinking about acupuncture, I would recommend that this person sees a medical doctor first, all right, just to exclude a serious illness underlying his symptoms, all right. So once this is excluded, all right, and if the person has no contraindications, the list of which I mentioned earlier, then acupuncture, yes, can be considered. It is a useful, effective complementary treatment for pain, and it is especially great, all right, for people who are allergic to the Western medicines, who find the medicines, they don't work, all right, or who do not like or want the side effects, they find that they are not worth taking the medicines, and who, and interestingly, people who believe in the effects of acupuncture tend to have greater benefits, all right, to derive greater benefits from the acupuncture treatment. So, and I find that we often need to combine, all right, various modes of treatment, especially for patients with more chronic, more complex type of pain, in order to get at the root of the problem, in order to experience longer lasting, all right, success and pain relief. It would be good to combine treatments. So let's say a lady has OA knees, all right, is overweight, has been having more and more pain in her knees, which restrict her from walking, from going shopping, things like that. So apart from acupuncture, right, which we can recommend and use for her, it would be also good to see what factors, what else can be corrected. Maybe she can lose weight. All right, we educate her on her lifestyle, maybe just a few sessions of physiotherapy, or even just teaching her some home exercises so that she can strengthen her muscles, her quads, which will protect her knee joint and actually help to preserve the articular cartilage that she has. And that combination, east-west sort of approach, might produce greater, longer lasting benefits for the patient. Okay. So in this last part of my talk, I thought I'll just introduce a few acupuncture points which are commonly used, all right, for various ailments, and for your consideration. You can try and do some acupressure and see, but these acupuncture points are very important, all right, almost bread and butter for a lot of acupuncturists. So first is large intestine 4, Hegu, all right. So this point is actually located in the space, in this fleshy area between our thumb and index finger. All right, so if you can imagine this triangular space, so the point is located near the apex, near the tip of the triangle. All right, if you press firmly in this fleshy part between the bones of your index finger and the thumb, sometimes you can find that it is slightly sore. So it is actually very good for treating problems in the head and neck area. All right, if you have headache, migraine, you have blocked nose, running nose, toothache, sore throat, this large intestine 4 would usually receive treatment. Because this point lies on the large intestine meridian, and acupuncturists also use it to treat patients with symptoms of intestinal issues such as bloating of the tummy, constipation. The meridian also runs along our arm to the shoulder area. So patients with pain and stiffness of the shoulder would also get this point treated. And large intestine 4 is also believed to stimulate our immune system. However, it's contraindicated in pregnant women because it can induce premature labor. So we are very cautious, again, in pregnant ladies. Pericardium 6, PC stands for pericardium. Pericardium 6 or 内关 is a point that is very often used for nausea, vomiting, morning sickness, motion sickness. And it is actually located on our forearm, all right, the palmar aspect of our forearm. So if you put your 3 fingers, all right, your ring finger just next to the lower part of your hand on your wrist, you find that the point is just next to your index finger, and the point is located between the 2 tendons. All right, if you just move your wrist around, you can actually see these 2 tendons popping up. So the point is located 3 finger breadths beyond your wrist between the two tendons. Okay, so people with nausea, vomiting after chemo would get this point treated as well. And there's some, I think, motion sickness, little wristbands where they contain some metal structures or something that you know that the company will tell you place this over the neguan, all right, in order to reduce the discomfort from motion sickness. Okay, Zusanli, stomach 36, ST stands for stomach. Okay, so it is located in the upper part of your leg, right? So if you're sitting down, what you can do is you place your hand, all right, your index finger against the lower part of your kneecap. This is your kneecap against the lower part. All right, the point is actually just below your little finger, a little bit more on the outer aspect of your leg. All right, so if you put, another way of locating this point is to place your palm on the kneecap. All right, and then the point is just next to the tip of your ring finger. Okay, so this is also a point that is very popular among the acupuncturists because it is useful for treating weakness of the leg or stroke, right, such as what occurs in stroke. Because it lies on the stomach meridian, it can be used to treat the digestive problems of digestion, such as pain in stomach, vomiting, diarrhea, constipation. All right, it is also believed to support and stimulate the immune system and might be useful for mood disorders. So in summary, just a few perhaps take-home messages. Acupuncture has a very long history, all right, as one of the modalities of TCM. It is very popular in Singapore, as well as in the West now, apart from China and some of the Eastern countries. Right. So I've shown that actually acupuncture, how it works, how we explain the effectiveness of acupuncture differs, right, quite a lot between the TCM concepts, points of view, and from the Western medical scientific point of view. Research evidence has been conflicting because of the difficulty in performing very high quality studies for acupuncture, but the evidence appears to be quite strong for the use of acupuncture in treating various painful conditions. For those who have had pain for some time, not quite responding to various trials of therapy, it might be important to exclude more serious underlying diseases. And it is important to consider, I suppose, safe and effective combination of treatment of East and West approaches so that the patient can benefit from the best of both worlds. Okay, thank you for your attention.